One wrong needle placement can cause nerve damage. Here's how to inject safely. Don't guess where to inject, learn the safest time injection sites right now. Need to give an intramuscular injection? Here's the right technique and safest sites, I promise. Checklist for IM injection. 1. Hand hygiene, always wash or sanitize hands before and after the procedure. 2. Correct site selection, choose the right site based on age, muscle size, and volume of medication. Deltoid, ventrogluteal, vastus lateralis, dorsogluteal 3. Use the right needle size and length, adults, typically 22 to 25 gauge, 1 to 1.5 inch needle, infants, to 1 inch depending on muscle thickness. 4. Skin prep, clean with alcohol swab in a circular motion for at least 30 seconds, let it dry. 5. Correct angle, insert the needle at a 90 angle for deep muscle penetration. 6. Do not reuse needles or syringes, always use sterile, single-use equipment. 7. Stabilize the muscle, either stretch the skin or pinch the muscle depending on site and patient size. 8. Use Z-track method, recommended for adults, prevents medication leakage and reduces skin irritation. 9. Do not inject into a blood vessel, aspiration is optional, but observe for blood return if used in high-risk sites. 10. Aftercare, withdraw needle swiftly, apply gentle pressure with gauze, and dispose of the needle safely in a sharps container. There are 4 common IM injection sites, as already mentioned. Let's dive into it deeply. First is the deltoid muscle in the upper arm. This is a good spot for small doses like vaccines. Next is the ventrogluteal site on the hip. This is the safest place to inject in adults because it avoids major nerves. Anterior superior iliac spina, cease front top of the hip bone. Technique: place your palm on the greater trochanter, right hand on left hip or left hand on right hip. Point your index finger toward the ascese. Spread your middle finger back along the iliac crest, forming a V shape. The injection site is in the center of the V, in the gluteus medius muscle. The third site is the vastus lateralis muscle in the thigh. This is the preferred site for infants and children. And the fourth site is the dorsogluteal muscle in the buttock. This site is less recommended because of the risk of hitting the sciatic nerve. Dorsogluteal site. Anatomy: located in the upper outer quadrant of the buttock. Traditionally a common site for IM injections. Ventrogluteal site. Anatomy: located on the side of the hip, specifically the gluteus medius muscle. So when giving an IM injection, always locate your landmarks to avoid complications. Now let's review the technique. Clean the site with alcohol, stretch the skin flat in more fat muscle or pinch it for thinner patients. Insert the needle at a 90-degree angle swiftly. Aspirate if needed. Aspiration is generally optional, not routinely required for most IM injections, especially in the deltoid, ventrogluteal, and vastus lateralis sites. According to World Health Organization (WHO), aspiration is not recommended before IM injections for vaccines and most medications, especially in the deltoid muscle, because there are no major blood vessels there. Centers for Disease Control and Prevention (CDC), aspiration is not required for routine IM injections like vaccines. Inject the medication slowly, then withdraw the needle and apply pressure to the site. Be sure to use the Z-track method to prevent leakage, and rotate your sites if you need to give repeated doses. Congratulations, you now know how to give an intramuscular injection. Master this skill, it could save a life. And for more clinical skill video, don't forget to subscribe my channel for many more notification. Thanks for watching.